Assalamu alaikum. This is Amina from New Wave Global, and I'd like to welcome you to our new medical program, Wellness Compass. It's going to be a medical show that is going to serve as a personal guide to intricate world of health and wellness. I know it's not easy for a layperson to navigate the difficult medical jargon, and also it's harder for you as medicine is evolving and progressing. It's becoming harder and harder for people to understand what's going on with certain subspecializations, and it's becoming more and more intricate as we go along. So it becomes very, very hard for a normal or a lay person to navigate the difficult medical world. So I'm trying to design this format where we'd be able to empower you with knowledge and equip you with tools to navigate your difficult and sometimes complex medical journeys. And we're going to make this relatable and engaging for you. And I figured what would be the best way to start this off, and the first thing that came to my mind was the brain, the mental health, which is very, very commonly ignored. We worry about our blood pressure, we worry about our diabetes, but nobody ever mentions about medical health. We don't even consider it as an issue or a disease. So I thought as an initial episode of my program, I'd like to highlight that. And I'm very grateful for Dr. Mohammed Zishan for joining me today. He is a psychiatrist, and that doesn't even begin to define him. He occupies so many roles, and has been involved in mental health issues over a very, very long period of time. He's faculty at University Hospital Newark. He's a child psychiatrist. He's an adolescent psychiatrist. He even is involved in adult psychiatric issues too. Thank you, Dr. Mohammed Zishan, for joining me today so early in the morning, but really grateful to have you as my first guest as a kickoff to this Wellness Compass.
Now, first of all, I would like to congratulate you to start this, and I can, based on my background in parent coaching and leadership coaching, I think the key what we learn is always to start. Because many times we in leadership, they teach us, sometimes we optimize things so much. I need to have this kind of setup, this kind of speaker lineup, then I will start, this initiative. But I'm glad you are taking the first step. So that's huge. And I hope, from there, continue to, doing such important discussion. And I'm really grateful for you to create this space where, we can discuss not only as a physician, but also as a parent, also as, growing up in Pakistan, different culture, raising kids in United States, and what we have been seeing. And I'm so happy to have this space with you, and I'm grateful and feel honored to be the first one for this initiative.
Thank you. I'm glad. So we're going to set off our our wellness compass by talking about the mental health issues, because I feel like they're very, very ignored. And a lot of times we don't pay as much attention to them as we should be paying to them. And in fact, I believe that makes a very, very important part of our health. So I'd like to ask you, since what are the most common health challenges that you see in children and adolescents today? And what are the most important issues that you would like to highlight for parents and caregivers like us?
Again, I think the couple of anxiety, I am seeing a lot. ADHD, which is attention deficit hyperactivity disorder, where children, teenagers, they struggle paying attention, zoning out, get distracted very easily. Depression, school-related stress, that is also especially, academic pressure, extracurricular activities, depending on, especially if you're in middle school, bullying, high school, when you are determining what career path you choose. So junior year, senior year can get pretty difficult. And so those are the top concerns. But the other thing is social media pressure that I'm seeing nowadays, that, what people are posting, how they are posting. Because of that, their body image, weight, suicidality, and similarly the academic competition also play a major role, because I strongly believe the sports as extracurricular activities, this need to be more like a fun. But unfortunately, what I'm seeing that it is adding significantly more pressure, sometimes more than academic pressure, because because it just, instead of becoming it more fun and more relaxing, it is actually causing more stress and more depression and anxiety.
Yeah, that's very, very interesting. And that's quite a long list of challenges that you described. But I'm pretty sure that there are actually a huge concern at the moment in children and adolescents. But the other thing that I wanted to highlight was that we as parents, and a lot of times, care providers, even sometimes teachers, tend to minimize these issues, or we're like, we attribute it to like, hey, you're just, the kid is just being lazy, they don't want to do it, they're finding excuses not to do it. But at the same time, this issue is becoming more and more to the forefront, and a lot of times we feel like that maybe kids are using it as an excuse. So what's the fine balance? How do you really kind of weed or figure out if it's actually real, or if it's just, kid actually being lazy? Because I feel like I hear stories, or I hear both sides of the argument, and then it becomes harder and harder, because a lot of times, people coming from our backgrounds, like South Asian backgrounds, we as parents tend to be like, hey, no, you're a kid, how can something be wrong with you? You're just being lazy, you're just trying to make up excuses to get out of that thing. But on the other hand, I feel like more so in the Western world, it's becoming more and more like, oh, maybe it's just, I feel like it's becoming harder and harder for us to strike a balance where we feel like, okay, this is a problem, versus no, this is really just a kid being a kid.
So let me give you, because it's a very important question, and the Eid is coming in a few days. So let me give you a couple of examples, and then will lead to how we can manifest these examples that we learn from our prophets in current days. So let's take Hazrat Ibrahim alayhi salam. When he saw, as a Muslim, what we know, that he has this dream, that he need to sacrifice his son. So we as Muslim is more Hazrat Ismail, and some his Hazrat Ishaq, Isaac, and so there are different narrative there. But the interesting part which I want to highlight, so now this is a prophet message directly from Allah, that this is, you have to do. But before doing it, he is asking his son, what do you think?
Mm-hmm.
So it's not that I grew up in South Asia, I learned, that being strong, just keep hard work, ignore all those, the function, the parents used to sell, don't think about, this sadness, depression, just work hard, you will get good marks. And so although we have seen all these practices might have helped us, okay, we have seen these practices may have helped other growing up, but we are raising, children there. So I think it's important to ask, if we want our children to, excel, and if we are seeing they're using this an excuse, to having this conversation, what do they think, and being open to what they are, sharing it. So that's one example. Being a parent, the second example I gave from Hazrat Noah alayhi salam, Prophet Noah. Again, Prophet, has been preaching for so many years, but even his own son did not follow what he was trying to say, but that does not make him as a bad parent.
Mm.
So the second point that I'm trying to highlight is that our children, if they are, doing something that so more disrespectful, they are failing in few things, or they are not being respectful, it doesn't mean that you as a parent is failing. It doesn't mean there is something wrong in your child. So that's the second thing. So that being said, and then I will share, Molali's quotation that, we should not raise our kids the way we are being raised. Our children are born for a different time and a different generation. So that preface, let me go back to your question. So either my child is making an excuse or my child is actually lazy for this, what they are saying, not working hard in school, or not doing homework and getting 6 hours on video game. I think it's important to have this conversation with our children. I think what is happening is that our children are feeling that our parents are telling us what to do without listening to us, because children, they need parents advice, they need parents wisdom, they need them to guide them, but guide them in a way that they feel being heard, they feel being understood, they feel being listened. I think what is happening is, the way we grew up, most of us, and I'm not saying that, again, not that our parents have done something wrong, this is the best they could have done, but if I ask most of us, how many times we are being, understood, being respected who we are by our culture or by our community or by our loved ones. Mostly we have done, this is the thing to do, you work hard, and and we have seen these things are helping. So what I'm trying to say now, this is a different time, just like Hazrat is saying, we need to sit with our kids, that I feel, that you are spending more time on video game, and when I ask you, you, why you're not putting enough time to homework, or when I ask you, why you are not doing your schoolwork, and you are saying this thing, I feel that, that's something I am missing. Don't label it as lazy. I think something I'm missing that I'm not understanding. Can we work together? Can I able to see, and can we talk about how to help you, so that you can do things which are important, like schoolwork, sleep, dinner, family time, and then you can have some time where you can connect with your online friend, where you can play video games. So the key is, instead of labeling, instead of judging, instead of assuming, have that open discussion with them.
Okay, so maintaining a dialogue at all time is the key. Having an open channel of conversation where the kids can come and speak to you and feel that they're being respected, their opinions are being considered, at least before making any decisions about what should be done. So an open dialogue is extremely important. So just as a segue from that question, I just wanted to say or ask, what are some signs that parents should be looking for, which may indicate that the children are struggling or they're having mental health issues? Any specific red flags or behavioral changes that you think should raise some concern in a parent's mind and think that maybe their child is actually struggling with mental health?
A really good question. I think sudden changes mood, changing in sleep, like if they are sleeping more, sleeping less, waking up early in the morning, huge than usual, waking up multiple times during the night time, going to sleep, having significant uh, problem going to sleep, and if that is a changes in appetite. So these are pretty simple. If they are eating more, eating less, school performance, and then avoiding activities that they used to enjoy. So those are some of the warnings, and similarly, frequent meltdown, or they are becoming more isolated. So those are, I would say, a broad some of the indicator where I think parents need to get worried about.
Okay, yeah. So anything that is out of the ordinary. So if your child is behaving in a fashion that is not what they usually are, then that should raise some concern. Maybe at least start a dialogue from the parent's standpoint to delve into it a little deeper. Um, Another thing that I want, us as parents and people in general to understand is that how does the environment affect a child's health? Like, for example, family dynamics, anything going on in the school, atmosphere in the school. And you did touch on it a little bit, in terms of bullying and all of that, or community in general. Some of the things, just for us to understand how environment impacts a child's health, mental health in particular.
I think, let's talk about home environment, let's talk about school environment, and let's talk about the culture one by one. So home environment, if the way is the comparing each other, look at your other sibling, look at your friends, look at that neighbor, how good they are doing. So if the comparison is something that parents are trying to motivate their kids, if as if not having much opportunity to listen to them and just telling them what to do and how to do it without giving them opportunity. The third thing is, if we are not creating this environment where we have the room for our children to fail, make mistakes, and be open and honest to share those things with their parents without being scared of being penalized, and how parents are open to have those conversations rather than in a punitive way. I told you not to be on your screen. I told you not to hang out with friends. So if we have that conversations, the environment, safe space, that's where the can be helpful, because if they don't have that safe space, then they are going to get that space either from social media, from their friends, or they are trying to learn to hide their emotion, and then it may come out as a burst out of anger, out of the frustration, sometimes suicidality, and then parents would say, we have no idea our child was going through, and it's very surprising, very shocking. And the reason is because the child might have been sharing a lot of clues, but we have either were not have that safe space, and the child and the teenager may have learned there's no point, because it just add more shame, more guilt, more frustration, more tension between parents. So that's a home environment, that plays a role. Let's go to the school environment. Is it a public school, private school, Muslim school? All have different challenges. I'm not saying one is better than the other. But I think in public school, I think the bullying is across, especially in middle school, based on the color, based on the weight, based on uh, um, um, based on the traditions. So that's what I have. Color is definitely I have seen a significant amount of time. Similarly, how much diversity in the school they have, because sometimes if the only brown child or few brown kids in a more not that diverse. So I have seen the teachers, they are having difficulty understanding, or there are more judgment, there are more bias seen many times in that way. Similarly, how much awareness and the training teachers and the principal and the school counselor and the guidance counselor have about mental health awareness, because many times I feel so bad that our children, neurodiverse children, especially ADHD, anxiety, depression, that is across no matter what your background in race and ethnicity is, I have seen they are either being labeled or they are being more dealt with a punitive way. If you are not working hard, if you're not doing homework, we are isolating them, or this is, you are not able to attend this, or you cannot have your recess time. So having that awareness in school, and what are their parameters, when there are bullying incident happening, when they are reporting about it, how open the conversation they have. So that's the second in the school. The third thing, definitely in the community, what the social where the kids are hanging out, what the parents environment, parents friendships are, what their play dates, the summer is coming, what their summer activities are. Sometime I have seen that some children, the parents are more open to have, so almost 2-3 month time, they are more proactive to schedule some activities, summer camp, summer activities. Some parents, they may have this open time, for the children, where I have seen there is more social media, and those Facebook and video games are coming along. So I think those are the couple of things I would say, how these three areas are contributing to the child emotional and mental well-being.
Okay. So I know we've spoken a little bit about what are the mental health disorders that kids are, or challenges that the kids are facing. I was just wondering if there is something that you could probably tell them as to how to deal with some of these issues. If the child is going through a period of stress, or if they feel like they're very anxious, and is there anything that they could do on their own maybe to relieve some of that, or maybe some advice for the parents where they can coach their child or guide their child as to how to deal with these situations in a better fashion?
So I usually share five-step approach. The first thing is, as a parent, it's very hard to see our children, teenagers go through some difficult time. We try our best to not have, our children come across any kind of difficulty, but this is just part of, the normal they're growing up. So there may be incident where they may not do well in exam. There may be incident where there is some behavioral issues in the school. There may be incident when there are some issues at the playground. So these are all, or there may be incident then where they mess up. So whenever those kind of situation happen, the five-step approach that I usually share with the parents is, the first thing is we remind ourselves, the more I stay calm in those situations, the better I'm able to help my child. So instead of going into, who told you don't do that, who told you not, that's not the right subject to choose, the right sports to join, right friends to hang out. And so rather than going that, you may know, and I strongly believe parents know their child the best. You know why your child mess up, you know what are the contributing factors. So rather than going into right and wrong, fixing, advising, the first thing you remind yourself, the more I stay calm, the better I can help my child. So that's first step. The second thing is you validate your child feeling. That's a very ironic that if some people say you are telling us that, if my child mess up, I am just reinforcing, by validating the feeling. But what Dr. Dan Siegel say, name it to tame it. Like if we can help our children to name their feeling, they are more likely to tame the feeling. So the second thing is if your child seems sad, upset, frustrated, scared, angry, irritable, just say it. You don't need a psychology background to mention what feeling they are going through. Just say it. You seem pretty angry, you seem pretty upset, you seem pretty frustrated. And then the third thing is you know what your child have done wrong rather than, again, right and wrong. I call it a 10-minute Dr. Z rule, where you use the curiosity, you use the exploration. Your child, so you stay calm, you validate, it seem like you're very frustrated because, you did not do well in school. Tell me a little bit more. When your child say, oh, my teacher, and they may make excuses. That's the first question that you were asking. They may say this, and these are all excuses. But rather than, again, going into right and wrong, you just ask, you repeat what they said. So you feel like you failed this, exam because your teacher were not able to teach you properly. But tell me a little bit more, what specifically your teacher was not able to communicate, what helped you to do well in that subject and not in this subject? What was going on that you got into argument? What was the other person saying? What were you said? How did your teacher respond? So you are using curiosity, you are using exploration, you are repeating what your child is saying in a summarized way. So these are all things that is helping your child being understood, being heard, not being judged, and you're giving your child and a space where the child is brainstorming, and trying to help come out what could have done. And the fourth step, so that is a collaborative exploration for 10 minutes. And then the fourth is based on whatever the discussion you have, then share some thoughts. So, it seems like that I can understand you seem very frustrated and because of this, and you mentioned that because of this reason. Can we try these things differently? So then when you give suggestions, so Dr. Dan Siegel said, now they are more likely to listen to your suggestion because you listen to them first, and they are more likely to listen to you. And the fifth step is you reflect. Reflect means that last time this situation happened, and I was able to listen to him or her or them by this way, and it was helpful and it was not helpful. So these are the 5 steps that I share with the parents that may make failure, may make these all feelings, sadness, all those child doesn't have to hide this feeling, doesn't have to feel ashamed. And definitely, as a parent, we need to help our child what is wrong and right. And we need to help them how to move forward, but do it in a way that make them feel heard, understood, not being judged. So more kind, more empathic, and do it in a way that we are both learning together with this experience.
Thank you, Dr. Zishan. I'm sure that's very helpful for the kids and parents out there. There's one other thing that I wanted to bring up. I know that, you gave them strategies where they could navigate some of the mental health issues that the children are experiencing, and the parents can help them with it. But then again, I feel like there's still a lot of, despite the fact that there's a lot of openness, there are a lot of conversations going on about mental health at this time point. We're becoming more and more accepting of it, but I feel like that there's still some stigma attached to it. Parents don't want to mention or even want to admit in the first place that their child could be having mental health issues, let alone seek medical help. So as far as that goes, what's your advice in helping parents navigate those thoughts, those feelings, and also maybe somewhat reducing the stigma around mental health?
I think normalizing conversations about emotions, including mental health in school curriculum, and share stories of healing and hope within families and communities. I think that's one. The second thing is that if you have young children, there are a lot of stories on how to express your anger, how to how to make anxiety as a normal feeling. And just to share some, I just actually about to publish 6 child animated stories where we are working on. One is mom and dad, I freeze when you yell. Mom gets scared too. And in one story, we are teaching raccoon some manners. So I think making these stories, especially for younger children, where they can learn, that feeling, and seeing the parents are talking about, let's say if a child feel anxious, how they bring this conversation to the parent. So I think that one thing, if I may share one brief story, during COVID time, so I have my daughter, she was 4 at that time. So one day, I used to put her to sleep, and one night I was about to put her to sleep. So she held my hand, and I used to say, it's my princess, it's time to go to sleep. And she held my hand and she said, Papi, I don't want to be your princess anymore. Can you spend another 2 hours with me? So, and that was, I sat with her, I asked her, what is about tonight? And she was able to share that she feels scared, she feels isolated because she's not going to daycare, preschool. And then I sat with her, I also feel that way, and it's pretty normal to feel that way. Tell me more about what are the other things that make you feel, isolated and anxious. And she was able to share me so much, and I was able to share, sometimes I feel that way. And one time she was asking that, I was very surprised that you also feel, that way as well. And at the end, the moral of the story that, I wrote, I don't want to be a princess, that the title of the story is, that at the end I shared with her, I cannot fix everything for you, but is it okay that you and me are good enough for each other? When you struggle, you come to me. When I struggle, I'm able to share with you as well. So I think having these conversations at home through storytelling, having this conversation in school, sometime even some of my patients, I encourage them, to have, let's say I saw one on selective mutism. So, I ask the school to have that conversation, some documentary or PowerPoint with all the children so they understand what the child is going through. And that was very helpful. So I think those are the couple of things I would share to reduce stigma. And similarly for the teachers, how we can implement some program that can social emotional learning program, and also, providing safe space both in school and also at home.
So again, thank you, Dr. Zishan. I think that's very helpful. I feel like since the whole object of this wellness compass is to simplify things for people, and I feel like your overarching message is very simplistic. It says that, have conversations, talk to each other, listen to each other. Even if your child, like in your case, was 4 year old, and a lot of times we tend to ignore them. We're like, oh, this is just a child being a child, or just having a moment or a meltdown or a tantrum. But it's so important how you just pointed out to have a conversation, just even if their concern is minor in your head, it's probably a big thing in their head. And once you have a conversation with them, they feel heard, they feel validated, and that's very important. And that also helps, like you said, reduce the stigma around the situation. So normalizing things, having conversations is extremely important. The one last question that I wanted to ask you was that medicine is every field of medicine is ever evolving. Things are happening at a very, very rapid pace. Something new is coming up every single day. Is there something that's coming up in child and adolescent psychiatry which you're really excited about and you think that might be a game changer?
I think in child and adolescent psychiatry, what I am seeing more and more of having discussion, not focusing on the symptoms itself, but also learning I use this analogy is the iceberg. So, the not only focusing on the tip of the iceberg, which is anger, irritability, behavioral issues, but try to understand what is underneath the water. And rather than making behavioral plan based on their behavior, punishment, rewarding, which used to be very popular. But nowadays we are focusing more on what is functioning behind that behavior and having more understanding what the child is trying to communicate with this behavior rather than how can we fix this behavior. I think I'm very excited about that change and very excited about this underneath and unpeeling and focusing on that rather than just focusing and labeling on what the child is displaying.
Thank you so much, Dr. Zishan, for your time. I'm sure people will find it very helpful as they navigate their own personal health journeys. I do, and I think this is a perfect start to Wellness Compass, since I feel like a sound mind. Well, if you have a sound mind, a sound and healthy body will follow. And this Wellness Compass is basically, it's a voyage. It's not a single episode. Every episode is going to be a new destination where we'll be bringing you more experts, sharing their wisdom, their insights, their practical advice with you. But once again, thank you, Dr. Zishan, for helping me kick it off. I really
Uh,
appreciate it.
it's it's my pleasure, and I can just close. If healing is possible and no child should suffer in silence, let's join hands together and able to listen to our child, understand them where they are at, and help and support each other both as a parent in a more compassionate and more empathic way. And thank you
Thank,
again for inviting me.
thank you so much. Beautiful message to end it. Thank you.